Hi everyone, this is M.B.B.S nerd, and in this video I'll be talking about acute myeloid leukemia. So let's begin. In this video I'll be talking about the introduction and classification of acute myeloid leukemia. So what is acute myeloid leukemia? It is a malignant proliferation of hematopoietic progenitors caused by acquiring oncogenic mutations that lead to the accumulation of immature myeloid blasts in the marrow. Now let me break this definition for you. Basically, that what happens is that let's go to this image and check this out. Yes, there in a bone marrow there is a hematopoietic stem cell which multiplies which becomes multipotent progenitor cell, and this multipotent progenitor cell becomes the progenitor cell having predilection towards myeloid differentiation and predilection towards lymphoid differentiation. But if in this lineage or this whole lineage of blastoid cells, I'm not talking about these mature cells, up till here, in this lineage of blastoid cells, there are some mutations which can be due to radiation exposure or any kind of alkylating agents or drugs which cause these blastoid cells. See, in a normal blast cell, if I talk about a normal blast, this image is not the actual image which we see after staining, but yes, this is just for explanatory purpose. A normal blast cell has a property of both proliferation, I will just write prolif, and differentiation. Both of these things happen, but during acute myeloid leukemia, what happens is that there is lack of this differentiation process and only proliferation occurs, and this causes the accumulation of these myeloid blasts, or you can say myeloid blast of any series. For example, if I talk about colony forming unit granulocyte, colony forming unit monocyte, or a monoblast, myeloblast, eosinophiloblast or basophiloblast, megakaryoblast or erythroblast, then any kind of blast which is accumulating in this series which you see here, that is or you can say that comes under acute myeloid leukemia. And myeloid leukemia also because these blasts are coming under the myeloid series of cells, not the lymphoid series of cells which we talked about earlier. So the basic funda, or you can say the basic explanation, is that these blasts normally they had proliferation and differentiation, but when differentiation became absent due to some mutations, then there is only proliferation, which is not a case of a normal blast, and then it becomes acute myeloid leukemia, as simple as that. Now if I talk about the classification, then see, there are actually two type of classification for AML, and first one is the WHO classification, which is the World Health Organization, and the second one is the FAB classification, or the French American British classification. So the WHO classification, it divides AML into four type of classes on the basis of different mutations and the morphological features which has been seen. So there are four classes, and then there's this fourth class which is called AML not otherwise specified. This classification is what is called French American British classification. So let me break down the different classes of acute myeloid leukemia for you. So first we begin with AML with genetic aberrations. Genetic aberrations, or AML in which there is a particular type of genetic, you can say mutation or a genetic fusion, to be particular. If I have to say that there is a genetic fusion, for example, you see here that there is a fusion of CFBMYH11 gene, and then see, I can talk about all these genetic aberrations, but it would become boring for you, so I will point out the most important one. So basically these two genetic aberrations are very important for you to know, because see here what is happening, that there is translocation of these gene segments Q22 or 1112 between chromosome 15 and chromosome 17, and this translocation of this fusion gene is, if you have read, you must have read this in Neoplasia, that after a fusion gene or a chimeric gene is created, something happens. Either there is a coding of a chimeric receptor which is constitutionally activated or activated all the time, or there is something which leads to impaired differentiation. So that is what happens here, that this fusion gene leads to the impaired differentiation, leading to the accumulation of the myeloid blasts, just like I told you before. And the prognosis here is very favorable. And then there's the second one, or you can say again KMT T2A fusion genes are created here, which again lead to the accumulation of myeloid blasts. Now, if I talk about the morphology of these two important acute myeloid leukemias, then the morphology is that in AML with translocation 1517, we see numerous OR rods often in bundle. Now, what is OR rods? Now, OR rods are rods containing MPO enzyme or the myeloperoxidase enzyme. Now you see that myeloperoxidase enzyme is important for neutrophils, monocytes, or all the granulocytes for producing free radicals, which are necessary to kill microorganisms. That is why they have OR rods in them. And this AML or this type of AML is also called acute promyelocytic leukemia. And I will talk about it further when I go to the FAB classification. Now, if I talk about AML with M.B.B.S like features or myelodysplastic syndrome like features. So, what first of all, I have to tell you a little bit about myelodysplastic syndrome. So, myelodysplastic syndrome is a syndrome in which there is in which we see the dysplasia of blastoid cells. Now, see, dysplasia is different from cancer. When a cell is having impaired differentiation, but it is not proliferating also, it is on the verge of becoming a cancer. For example, I had a cell here which normally used to mature and become some other cell, some other smaller cell, which we see here. Now, if this cell is lacking differentiation, diff, if it is lacking differentiation, and also there is some abnormal kind of maturation which is occurring, or there is some you can say defect in the cell which normally causes it to mature into something else or causes it to mature in some other cell, but it is not happening, and that is leading to the accumulation of these blast cells. Because see, normally these blast cells, if you see in this diagram, they are maturing and becoming, for example, if I talk about a eosinophiloblast, then it is maturing and becoming eosinophil. But due to dysplasia, first of all, it will have impaired differentiation, and then it is also lacking all the properties. It is not multiplying here. Mark my words, that dysplasia is not cancer. It is the you can say dysplasia is something which is precancerous, which can become cancer, but it is not at all a cancer, because now dysplastic cells are not highly proliferative just like cancer cells are. They are on the verge of becoming cancer. So myelodysplastic syndrome, what we see is that these blastoid cells are dysplastic, but they are not cancerous. So here we talk about AML, which are having M.B.B.S like features. Now there are three subtypes in this. First is a AML having prior myelodysplastic syndrome, in which a patient was having myelodysplastic syndrome and then that transformed into acute myeloid leukemia, and the prognosis is poor. And then if I talk about AML with multilineage dysplasia, then there is dysplasia, but in a lot of lineage of these cells. I mean to say that there is accumulation of lot of these blasts, because there is dysplasia in all of these lineages, not only eosinophil or erythroid, all of these lineages like granulocyte, monocyte, eosinophil. So having multilineage dysplasia is the second class. And then there's this AML with M.B.B.S like cytogenic aberrations, in which the mutations or you can say the genetic aberrations or fusions which lead to myelodysplastic syndrome is seen in this acute myeloid leukemia too. Now, if I talk about AML therapy related, which is the third class, then it usually has a very poor prognosis, and it generally occurs after a patient has a alkylator or a radiation therapy. For example, he or she was being treated for some other kind of cancer, and for that we gave some alkylating drug or a radiation therapy, and that it's so weird and it's so funny that you are curing cancer, and in that process the patient is acquiring cancer. So that is what is happening here, is that due to the therapy the patient has got cancer. In you try to cure something and you get something else out. It's very funny and very sarcastic, but yes, this is a disease, we shouldn't get very much heartless here. So that is what happens here, that in AML therapy related we get acute myeloid leukemia because of drugs or because of the therapy or the chemotherapy therapeutic drugs which was being given to the patient. Now if I talk about AML not otherwise specified or the FAB classification, then it starts from M0 and ends at M7. So basically there are in total 8 types of you can say 8 subtypes in FAB classification. So let's start with AML minimally differentiated. Now you see that there is no differentiation or minimal differentiation, and the origin occurs from a PHC or multipotent hematopoietic stem cell. So you can just realize that this AML is arising from that kind of cell which is not even completely differentiated into myeloid, you can say myeloid lineage. So basically it is coming somewhere from here. That is why you will see in the morphological features that the cells which are found here in the bone marrow in this kind of leukemia is negative for myeloperoxidase and myeloid antigen. The only thing which is positive is CD34, which is positive for all the stem cells, irrespective if they are stem cells for bone marrow, if they are stem cells for your skin. And then there's AML without maturation. I would not use this term. AML with minimal maturation sounds better, because you see, if there is some little bit of maturation is seen here, little bit of myeloid maturation is seen here, because 3% of blasts are positive for myeloperoxidase, and they are also having CD34 positive, because though they have retained their stem cell property, but they are also showing a little bit of maturation. Only more than 3% of blasts in the bone marrow have MPO positive. And if I talk about AML with myelocytic maturation, and then there's AML with myelomonocytic and maturation, then monocytic, erythroid, and megakaryocytic. So what do you mean by all this? That we are saying myelomonocytic, monocytic, erythroid. Basically, the author here is trying to tell us that if I am talking about megakaryocytic maturation, then I am talking about a megakaryoblast. I am talking about a blast which is having the features, or you can say the precursor features of becoming a megakaryocyte. If I am talking about erythroid maturation, then I am talking about a blast which will immediately become an erythrocyte, but because of some mutations or some genetic aberrations, we are seeing accumulation of these erythroblasts and also increased proliferation of these erythroblasts. So that is what is the rationale here, or the thing which is happening here. And when I'm talking about a promyelocyte, then promyelocytes are also these blastoid cells which are at this level, or maybe any of this level, which are not gained complete maturations but also have that blastoid feature of proliferating very much. So let me talk about each one of them. When I talk about myelomonocytic maturation, then you can say that this monoblast or this colony forming monocyte, it is talking about the accumulation of these two type of cells. And we see here myelocytic and monocytic differentiation. And then there's AML with monocytic different maturation, in which there is full maturation, and we are seeing blastoid cells which would have immediately become monocyte, but since they are having some mutations or which are leading to impaired differentiation or increased proliferation of this monoblast itself, then that is causing this type of leukemia. And what we see here is that the monoblasts have they have non-specific esterase enzyme. Now this enzyme is very specific for monocytes. That is why we find it here, and it gives a short diagnosis that it is AML with monocytic maturation. If I talk about erythroid maturation or the M6 type, then we see again 50% dysplastic maturing erythroid precursors. Just like I told you, we see erythroblasts in the bone marrow, in the PBS, in both the peripheral blood smear and the bone marrow. Now you must be asking one thing, that we saw the M0 subtype, M1, M2, but where is the M3? Now the M3 subtype is this acute promyelocytic leukemia. Though it has been kept here, but this subtype is what is called the M3 subtype of the FAB classification. And then this AML with megakaryocytic maturation is most commonly associated with myelofibrosis, because megakaryocytes secrete. I will talk about this in later, that why it is associated with myelofibrosis, but just now for now you just know this. And we use the markers for megakaryocyte to differentiate this type of AML. And why is it important for us to know all these subtypes? Because you see the therapy varies for each of these subtypes. If it is a megakaryocyte, we can give inhibitors for the receptors for megakaryocyte. If it is erythroid, then it is necessary for us to know that what kind of maturation is occurring here, or what kind of blast, if to be specific in my words, then what kind of blast is present here, or what kind of blast we are seeing in the peripheral blood smear or the bone marrow. And yes, one more thing about this is that this KMT2A fusion gene mutation, which we were seeing in AML with genetic aberrations, is most commonly chemo resistant. I mean to say that whenever you will use therapeutic drugs, they will have no effect on this type of the subtype of AML with genetic aberrations. So I talked about the introduction and classification. In the next video, I will talk about acute promyelocytic leukemia, or the M3 type of you can say FAB classification in acute myeloid leukemia. So if you like this video, give a thumbs up, comment on the comment section.